Better health is fundamental to development because when a population is healthy, only then can they engage in other aspects of development. It's important to recognize that health and development is not just about understanding diseases and their impact. There is a much larger conversation around population age and well-being that development leaders need to consider. In this module, we will try to explore how development practitioners can use basic scientific knowledge of the linkages between environmental conditions, human behavior and choices, and genetic predispositions to have a more sustainable approach to health and development. Within sustainability science, the ecosystem is the broad term we refer to as the interconnected series of relationships between living things or organisms and their environment. We define a system's strain on the environment and the life it supports as an ecosystem distress syndrome. Within this context, health is an extremely important variable that can help us diagnose ecosystem distress. The key characteristics of this syndrome pertain to a loss of resilience, which is the ability of a system to recover from shocks. Furthermore, there can be a lack of organization of key components of the system, which lead to failures in function and a reduction in productivity. Health is key to making these linkages in understanding ecosystem distress. Why, might you ask, is that the case? The reason being that health is what matters most to us on a personal level, and we advert to those matters most. Now let us consider some of the attributes of human health and how they translate into ecosystem health. This slide lists some of the ways in which medical doctors and public health professionals measure human health. Under each of these metrics are embedded connections to the environment and hence ecosystem health. So first of all, prevalence of illness. How many people have a certain disease or illness? That is in itself a variable. Endocrine viability refers to our hormonal function of the endocrine system, and that can translate into how people are impacted by different chemicals. Fertility rates are an absolute indicator of how our endocrine system is reacting, but they can also be a measure of how educated a population is and how many children they are producing as a result. Infant mortality is linked to diseases at childhood level. Life expectancy is connected to how much healthcare delivery is available at later stages in life. Medical dependence is particularly linked to recurring diseases and those which may also be non-communicable. Hospital admission rates can deal with issues such as accidents and the level of safety on roads. Malnutrition is often linked to levels of available nutrition from both the kinds of foods that are available in grocery supermarkets, but also how much people are growing themselves in their subsistence economies. Obesity rates can be linked to the quality of food delivery as well as exercise and lifestyle routines. Suicide rates are linked to mental health issues and how people relate to their environment in terms of seasons. Substance abuse is similarly linked to those kinds of mental health issues as well as feelings of helplessness that may have to do with war or conflict. And then, of course, gender differentiation is something that we need to consider across all of these different variables. Biodiversity, which is both the level of number of species that are available as well as the level of habitat diversity over time, can tell us about the resilience of ecosystems themselves. More diversity can create greater resilience because ecosystems are often connected in their level of resilience to the number of species and the number of habitats that exist. There is also concern about invasive species. With global travel, there has been a persistent concern about certain kinds of animals and plants which can take over other ecosystems that might not be used to them. Within Australia, a prime example of that is the cane toad in Queensland. Fragmentation of habitat and isolation can also impact how human health is impacted by species diversity. For example, if you have lots of ecosystems that are no longer connected because road systems or other levels of human disturbance are making them fragmented, that will in itself have an impact on the level of health of the ecosystem as well as human health. So resilience of the system has also a lot to do with the level of rebound that it can encounter. This has to do with the kind of disturbance that exists. So for example, forest fires are a natural disturbance that some ecosystems may be used to. However, the kind of forest fires that may come about due to camping or human disturbance may not be best correlated to the kind of rebound that the ecosystem might endure. So you need to be able to figure out what is a natural disturbance and the ecosystem is able to recoup from that, as well as what we call an anthropogenic disturbance. Water and air indicators are extremely important in understanding the connection between environmental health and human health. We have some key indicators we use in this regard, like biological oxygen demand or BOD, as well as pH, which is the level of acidity that exists in systems. And we have acidity both in water as well as in air. For example, acidity in air is often reflected through acid rain, which has been a persistent problem, particularly in North America, as a result of coal-fired power plants, which are making sulfur dioxide levels very high in ecological systems, and that in turn leads to acid rain, which can impact human health in terms of how we are consuming water that is too acidic, or species which are consuming water that's too acidic, as well as impact on natural environments, which can be eroded much greatly by having higher level of acidity in water. Water acidity and water nutrient loading is itself a major concern as we have greater fertilizer usage. This leads to a disruption in nutrient cycling. We have particularly two kinds of elements which are very important in this regard: nitrogen and phosphorus, which are key indicators of ecosystem health as well as human health. If we have too much nutrient loading in particular water environments, they are also an indicator of sewage entering the water environment, because we tend to concentrate nutrients such as nitrates and phosphates in human wastes. So understanding the dynamics of nutrient cycling is inextricably linked to both environmental health and human health. Now, we also have the concern around how fast we have turnover in terms of the change and the quality of the cycling of these nutrients. So, for example, if we have erosion and that leads to a much faster degradation of soil, that's going to accelerate the cycle, which the ecosystem may not be used to, and therefore there will be less resilience. That is why we have phenomena such as algal blooms, where algae might take over a particular water ecosystem because we have accelerated the cycling of those pollutants. Anthropogenic pollutant uptake by organisms is a major concern as well. This refers to what we call bioaccumulation with certain pollutants such as heavy metals. So for example, mercury and lead have a tendency to accumulate in water and are taken up by fish, which in turn go up the food chain and get further accumulated as other organisms eat those fish. And the level of mercury, therefore, can be much higher in organisms that humans are going to consume, ultimately, such as cattle or other kinds of livestock. So the actual uptake of the pollutant by the organism is in itself a major connection between environmental health and human health. One of the biggest challenges we face in development is the connection between increased life expectancy and its impact on development support systems. This slide shows us the dramatic change that is expected over the next 50 or so years in the percentage of the world's population who are children versus those who are elderly. The demographic shift which is likely to occur will have dramatic consequences on health and development planning. There will be a need for a far greater focus on health services, infrastructure to accommodate elderly populations, and changes to how labor laws are structured. There is also a strange paradox being that as countries develop and people get healthier and live longer, the strain on development practice also increases. The Australian Planning Commission estimated the impact of aging on economic growth over the next 40 years or so, and this graph shows how current aging impact is going to lead to a trough in growth, which can ultimately be lifted through migration's demographic dividends. The term demographic dividend is important to note as a way by which the rise of a productive workforce can lead to economic growth. However, a non-productive workforce can actually lead to a reduction in growth and overall reduction in average quality of life indicators as well. The key, therefore, is to ensure that our population and health nexus remains carefully monitored and managed with effective social policy to provide adequate health services to ensure development. With long-term development planning concerns being addressed, we still have to worry about sudden shocks to any health system. Zoonotic diseases are perhaps the biggest challenge in this regard. These are diseases that are transferred from animals to humans as a result of environmental stresses. This diagram shows the recent connection between the animal environment and the human environment in the transmission and spread of the Zika virus as a pandemic. At every step, you will notice the key development challenges that need to be considered. The sylvatic cycle is the fraction of the pathogen population's lifespan spent in cycling between wild animals and vectors. Humans are usually an incidental or dead-end host infected by a vector. The urban cycle refers to how the transmission of the disease at some stage from animal cycle to human population gets accentuated because of our close habitation in cities. While urban living has many environmental efficiency benefits, it also makes human communities more vulnerable to zoonotic disease transmission. Global travel and commerce also accentuates this impact. Thus, development practitioners have to follow systems approaches that consider both the sylvatic and urban cycles to prevent pandemics. To conclude, let us reflect on this quotation from the former Prime Minister of Norway and the chair of the World Commission on Sustainable Development, Gro Harlem Brundtland, where she noted the primacy of health in development discourse. And I quote, "There can be no real growth without healthy populations, no sustainable development without tackling disease and malnutrition, no international security without assisting crisis-ridden countries, and no hope for the spread of freedom, democracy, and human dignity unless we treat health as a basic human right." For development practitioners, a basic knowledge of public health is thus absolutely essential.